Rachel Flum with the Economic Progress Institute. Thank you for joining us today and for sticking with us during our technical difficulties. I see we have about 58 people on, so we'll go ahead and get started, and hopefully some folks will join us a little later if they're a little late. So I'm Rachel Flum. I'm the Executive Director at the Economic Progress Institute, and I'm pleased to welcome you today to our first of two webinar series. This one is called Maximizing Benefits to Meet Basic Needs for Families and Individuals. For those of you who aren't familiar with us at EPI, we're a research and advocacy organization who focused on improving economic security for all Rhode Islanders. And I'm joined today by my colleague Linda Katz, the EPI's Policy Director, who will be providing the details on the health insurance programs and the Child Care Assistance Program. And we also have with us today Pam Jennings, who's the SNAP Outreach Coordinator for the URI Feinstein Center for Hunger-Free America. So thank you, Pam, for being here. And then we at EPI are very thankful to HealthSource Rhode Island, the Executive Office of Health and Human Services, and the Department of Human Services, who have provided the information for this webinar today. And we're especially thankful to Kim Morello-Brito of DHS, who is with us to present some information on how to apply for DHS programs, and also to Carson Colmar from HealthSource RI, who's on hand to help us answer questions. So thank you, ladies, for all being here today. While we certainly know that the integrated eligibility system is still a work in progress and not everything is running smoothly, kind of like this webinar today, we wanted to go ahead and have a webinar that walks through the basic eligibility requirements and what the current procedures are so that folks are able to access the programs for which they are eligible. I want to take a minute and thank Blue Cross Blue Shield of Rhode Island and United Healthcare, who both provided funding to support today's webinar. And now for a few housekeeping details. We emailed out a copy of the slides around 8:15 this morning in case you want to print them out and write on them as this goes on. We also will have them on our website. They're already on our website at www.economicprogressri.org/guide. And if you scroll down to the resources tab, you'll find a link to the presenter slides today. The webinar is being recorded, and we will email that out later for your viewing pleasure to connect back with. You are all on mute, but we welcome and encourage questions. The way we're going to do questions today is if you type them into the chat box on the left-hand side of your screen. We'll take a break after each section, and I will read the questions, and then our group of experts will answer them on air. If you're having any technical problems, please reach out to our communications guru, Juan Espinoza. His email address is jespinoza@economicprogressri.org, or you can call him at 813-526-3043. And if we don't have a chance to answer your questions today, we can follow up with a follow-up email as well. So with that, I will turn it over to Linda Katz to get us started.
Thank you, Rachel. Good morning, everybody. Thanks for joining us today. I'm looking for the slide. Okay. As Rachel mentioned, we're going to be going over today health insurance for families and individuals with Medicaid and qualified health plans purchased through HealthSource RI. As I'm sure most people on the webinar know, Medicaid is a much larger program, and in our next webinar, next Tuesday, we'll be covering eligibility for the other Medicaid pathways for people with disabilities, seniors, and other Medicaid eligibility pathways. We're going to go over the Child Care Assistance Program for families today and the SNAP program. I'm assuming that there are people with different levels of knowledge about the different programs. Some of you are probably very steeped in Medicaid coverage. Some may be SNAP devotees. And we hope that we're going to hit the right balance of overview and detail. And we are also certainly willing at EPI to do other webinars on topics of interest to people in the community and perhaps to delve more deeply into some of these areas if people are interested. So with that, let's get started with health insurance coverage. We're going to talk first about some of the changes that happened through a little-known program called the Affordable Care Act. The ACA was passed in order to establish a continuum of coverage for people to purchase health insurance coverage. And it did two things. It expanded the Medicaid program as sort of the base of eligibility to health insurance coverage for lower income U.S. residents. And it added the category of adults without children to the already existing categories of people with disabilities, seniors, children, and parents. So it sort of created a full spectrum of eligibility for all lower income U.S. residents. And then it built upon that the opportunity for trying to control costs and standardize health insurance coverage for people buying commercial plans by establishing the Health Insurance Exchange, a marketplace where people could compare and purchase qualified health plans, and then provided access to make those plans affordable to people through premium tax credits, which we'll talk about in more detail, as well as cost-sharing reductions, which has helped for people to pay for out-of-pocket costs. So people are now familiar with HealthSource RI, which really has two functions. One, it's Rhode Island's Health Insurance Exchange, and it's also the single application point for Medicaid and qualified health plans with tax credits. So let's just look at the qualified health plans. I mentioned there's financial assistance. So for individuals with income less than 400% of the federal poverty level, for example, that would be for a family of three, close to $82,000 a year. They can get a tax credit to help them pay for insurance. And then for lower income people with income less than 250% of the poverty level, which is about $51,000 a year for those for a family of three, they can also get help paying for co-pays, deductibles, and other out-of-pocket expenses. And in order to make this sort of single streamlined eligibility system for Medicaid and then qualified health plan with tax credits, the Affordable Care Act changed the income methodology for Medicaid for children, families, and single adults and pregnant women to conform to what the income methodology is for the tax credits and cost-sharing reductions, which is a tax-based income methodology called MAGI, which stands for Modified Adjusted Gross Income. So there are different income counting rules for the other Medicaid programs, but for the MAGI-eligible Medicaid recipients, it's by and large the same way of counting income and who's in the household for both Medicaid and accessing the tax credits. So let's look at who is eligible for Medicaid. These are the basics. This is the Medicaid, MAGI Medicaid. So children under the age of 19, parents and caretaker relatives of children under the age of 19, pregnant women, and then the expansion population, adults aged 19 to 64 who are not disabled. The person needs to be a Rhode Island resident, which means they live in Rhode Island and intend to stay. They don't have to be here for any particular length of time. They just have to they could be come from another state to Rhode Island tomorrow and apply for Medicaid coverage the same day or the next day. They have to have income within the limits, and unlike the other Medicaid programs, there's no resource test, so people don't have to show what they own. They have to be a citizen or have eligible immigration status, and we'll go over the immigration statuses in a little bit. And parents have to cooperate with pursuing medical support from a non-custodial parent as a condition of eligibility just for the parent. It's not part of the application process. It is something that happens after the parent is found eligible for Medicaid coverage. And what it should say here too is that a parent who feels that they or their children will be harmed either physically or psychologically if they cooperate with child support can claim an exemption from child support cooperation. And there is a domestic violence advocacy program that can help the person both get some safety planning and establish their eligibility for the exemption. So now looking at eligibility basics for qualified health plan with financial assistance. Like Medicaid, the person has to be a Rhode Island resident. Income needs to be less than 400% of the poverty level to access the premium tax credit. There's another tax credit that's available for parents of children who are receiving right care if the family's income is less than 175% of the poverty level, and they can access a state premium assistance benefit to help lower the cost of coverage for the parent. And finally, like Medicaid, the person has to be a citizen or lawfully present immigrant, and as we'll see, the eligibility for immigrants is much broader than it is for the Medicaid program. So this slide, we're going to spend a couple of minutes here, shows that the income level for Medicaid, or as it indicates on here, right care or Medicaid, varies based on the children, pregnant women, caregivers, and adults. So let's just go over how this works. The gold level here is the Medicaid income limit for the different categories. If the income is above the Medicaid limit, then you look at where the blue line ends, that people above the Medicaid limit can purchase a qualified health plan with tax credits. Then if you look at the third bar to the right, individuals who have income below 250% of the poverty level, so that could be either a single adult or a parent or caregiver, would qualify for the cost-sharing reductions, so help with out-of-pocket expenses. And then on the third bar to the right, there's an additional state premium assistance credit for parents whose kids are in right care and family income is below 175% of the poverty level. And you'll see the light blue line at the top, which indicates that anybody can use HealthSource RI to purchase a qualified health plan. It's just that the tax credit assistance ends at 400% of the poverty level. And the last line on the last box on the right care plan for former foster youth, as we'll talk about, there's no income limit for the category of young adults who have aged out of foster care. And we'll be coming back to that. So let's just look a little bit now at each of the bars. So let's look at pregnant women. You can see from pregnant women that the income limit for a pregnant woman is 258% of the poverty level. On our next slide, we have the chart of all the different poverty levels. So let's use as an example here a pregnant woman who's pregnant for the first time. The income limit for that pregnant woman is going to be $3,492 a month, because a pregnant woman always counts as a family size of 2, and if she's pregnant with twins, a family size of 3, and so forth. In addition, her other family members would be part of her household in determining the pregnant woman's eligibility. Next, let's look at the single adults. And the income limit for the adults without kids is $1,387 a month for Medicaid. And then you'll see on the other, as we look at the other chart, the income limits for a single adult for tax credits and cost-sharing reductions. And now let's move to children and parents and caregivers. The children's income limit, as you can see by the gold bar, is the highest income limit for right care coverage. So for kids in a household of 3, the income limit is about $4,500 a month. But if you move to the third bar, you can see that the income limit for the parents for Medicaid is much lower. So for parents, the income limit is only about $2,500 a month. So this means that there are often many families with parents who buy a qualified health plan with tax credits when their children are in right care. And as an example, if we had a family of 3 with income of $35,000 a year, that is income that's just below 175% of poverty. In that case, the children would be on right care. The parent would purchase a qualified health plan with tax credits, also be eligible for health paying with out-of-pocket expenses, and could access the state's premium assistance program to help lower the monthly premium costs even more. And we'll have an example of this going forward. I just want to say that when you see right care here, right care was the Medicaid program for children, families, and pregnant women that Rhode Island enacted back in 1993. We've really been always ahead of the curve in terms of providing access to health insurance coverage for children, parents, and pregnant women. Right Care is a Medicaid program. Some people still call the program Right Care. We've used alternatively in this presentation Right Care and Medicaid. The adults are not on Right Care, but they are on Medicaid. And the parents, kids, and pregnant women are on Medicaid, but sometimes we call that Right Care. So I'm not going to spend time on this chart. This is the various federal poverty levels for for all of the families for Medicaid, as well as for the premium assistance program, the state assistance program, which is the 175% poverty, and then for cost sharing and tax credits through HealthSource RI, which are the 250% of poverty and the 400% of poverty level. I will point out a little anomaly, which is that while this says federal poverty levels for 2017, these are actually the federal poverty levels in 2017 for Medicaid, which change in January of each year, but they're actually the 2016 poverty levels for HealthSource RI for the tax credits and premium assistance tax credits and cost sharing reductions. Those income limits will be increased to the 2017 limits as people buy coverage for 2018. So this chart will change when open enrollment happens for buying a qualified health plan. And I feel compelled to say, anybody want to say single payer at this moment? But we all know we have to hold on to what we've got with the ACA and Medicaid and make improvements. Okay. I'm going to talk for a couple minutes about household size. And when you hear Pam talk, she's going to talk about household size for SNAP. Looks actually different than household size for Medicaid. And generally, the definition for the household for most public benefit programs, the other Medicaid programs for Rhode Island Works, for the Child Care Assistance Program, is generally looking at sort of the nuclear family of parents, caretaker relatives, their spouses, and their children. But the household definition for Magi Medicaid is different. And it's also different between the households applying for premium tax credits and determining eligibility for Medicaid. I'm not going to go into great detail about this. If there's interest in having more detail, we can do another webinar, or I would advise that people who are working with clients who are applying for Magi Medicaid or qualified health plans, the best advice is to see a navigator or to call the HealthSource RI Contact Center for assistance. But I did want to just give a little bit of an overview here about how this works. So I'm going to just give an example of sort of a common experience where there's a family with a non-custodial parent. So we have Lisa and her son Michael, and David, who's Michael's dad, but is not living in the home. His parents are divorced. But David claims Michael as a tax dependent. Mom's income is $20,000, and dad's income is $40,000. So for purposes of determining eligibility for health insurance coverage through the HealthSource RI system, there's always going to be a test of whether the household members qualify for Medicaid first, and then if not Medicaid, the determination is eligibility for tax credits through buying a commercial health insurance plan. So let's just look here. Lisa, the mom, for Medicaid purposes, is a household of one. And also for eligibility for the tax credit is also a household of one. So she doesn't have any tax dependents, right? She doesn't claim her son, Michael. She's just a household of one. Michael, however, the son, is living with mom. And in that case, even though he is claimed as a tax dependent by dad, you look at Michael's eligibility for Medicaid by counting just his mom's income, the parent with whom he's living with. If mom's income were higher than the Medicaid limit and dad needed to buy a qualified health plan for Michael, then his eligibility is still a household of two for purposes of the tax credit. And now let's look at dad. Remember, dad's not living in the home, so we'll first look to see whether he's Medicaid eligible, and he's actually a household of two for Medicaid purposes because it's himself and his dependent son, Michael, but the income limit that's applied for David as for Medicaid is $40,000, his own income. So he may be eligible for Medicaid if his income is low enough, and if it's not, then he will be applying for or purchasing a health plan through HealthSource RI and applying for a tax credit. Okay, so we mentioned the magic word MAGI, modified adjusted gross income. Again, this is an area with a lot of detail that we're not going to go into, but just some high-level information for people to understand. Again, it's one way of counting income for both Medicaid and tax credits for QHP. So the income methodology is to start with adjusted gross income, or AGI, on the federal tax return. The AGI does not include most Social Security benefits, TANF, which in our state is called Rhode Island Works, supplemental security income, SSI benefits, or child support. So again, very different in the Medicaid world, because in determining Medicaid eligibility for the other pathways, all of those benefits do count. It's all the cash that the family has. But for purposes of MAGI and using this methodology, those sources of income do not count. Then what's added back to adjusted gross income are non-taxable Social Security benefits and also tax-exempt interest and excluded foreign income. An important point to note here is in adding back non-taxable Social Security benefits, the benefits of a dependent child are not counted. So if you have a mom and a child who are receiving, for example, survivor's benefits from a deceased dad's Social Security account, you would add in mom's Social Security survivor's benefits, but you would not count the child's survivor's benefits. And that's because the income of a dependent generally does not count in determining MAGI. While the methodology is the same in determining what income counts, how that income is used to determine eligibility is different for Medicaid and for the QHP. For the Medicaid program, we're looking at current income, and for the qualified health plan with tax credit, the tax credits for a qualified health plan, we're looking at the amount of income that the person expects to earn for the full tax year for which they're applying. And the system will look at what the income was from a previous tax year and apply that income for the current application, unless the person can show that there's a difference and that what they actually expect to earn will be different in the coming year. If they can provide a reasonable explanation for why that income is different, they won't have to provide proof of that income, but in some circumstances they may need to provide the proof. So let's look at Donald, who in 2016 earned $80,000 a year, and that's what is documented on his tax return. That's his adjustable gross income for 2016, but he lost his job at the end of 2017, and he expects to earn only $10,000 in 2018. So Donald can say, well, my circumstances have changed. I lost that job that was paying me $80,000. I only expect to earn $10,000 in 2018, and that's the income that will be used to determine his eligibility for tax credit and cost sharing reduction for the 2018 calendar and tax year. Let's talk a little bit more about eligibility for financial help when somebody buys a qualified health plan. We've talked about the fact that individuals are eligible if income is below 400% of the federal poverty level for the tax credit and below 250% for help with out-of-pocket expenses called cost-sharing reductions. They have to enroll in a silver level plan if they want to access the cost-sharing reduction or the state premium assistance for parents whose kids are in right care. And just as background, there are different metal levels of plans that determine how much the person is responsible for paying of their health care costs and how much the plan is responsible for paying. In the silver level plan, the plan covers 70% of health care costs and the individual 30% of costs, and then with help from the cost sharing reduction, they can reduce those costs further. For the premium tax credit, let's just talk about how this works. The annual amount of credit is based on the income for the expected income for the year. So thinking back to Donald, he was expecting to earn $10,000 a year for 2018. So when he goes to renew his health insurance coverage or apply for health insurance coverage, well, actually Donald, if he's single, is going to be eligible for Medicaid. So let's do Donald at $20,000, who's not going to be eligible for Medicaid, but will be eligible for a cost for tax credit and cost sharing reduction. The amount of tax credit for which he's eligible for the full year will be calculated, but he can choose to take that tax credit in advance, which is why you hear the term APTC, Advanced Premium Tax Credit, so that the yearly tax credit is divided by 12. Donald can use that every month to help reduce his actual premium payment. The federal government will pay the share of the premium tax credit to the carrier, and Donald will pay the rest of the money to the carrier himself. Because income may change over the year, and this is a yearly tax credit, when Donald goes to file his taxes, there will be a reconciliation. There'll be a determination of how much of a tax credit Donald was due for the year based on his actual earned income during 2018 and what Donald has received in advance. If it's decided that he's earned more than was expected and his tax credit should have been lower, he'll owe money back to the government, which will get adjusted in his tax return. If it turns out that he earned less than was used to determine his tax credit, then he will actually get that back as a tax refund. Let's spend a minute on eligibility for the state premium assistance. And remember, this is just for parents of children who are enrolled in right care, where the family income is less than 175% of the poverty level. And just as a why does this exist explanation, when the ACA was enacted, Rhode Island had been covering parents in the Medicaid program if their income was below 175% of poverty, but it rolled back the income eligibility for parents to the 146 lower Medicaid base amount, and then provided some assistance to help those parents buy coverage through HealthSource RI. So the premium assistance is in some ways trying to make up for the loss of being enrolled in free or low-cost Medicaid coverage. When a person applies for this for health insurance coverage through the customer portal, there should be a pop-up if it appears the parents are potentially eligible for the state premium assistance, and that should trigger an action by DHS to apply the state premium assistance amount. But my friends in the community who do this work say that the best idea is to submit the paper application for the premium assistance, and you have a link here to where the parent can find that application with some instructions. And the parent who is eligible for the state premium assistance will get a reimbursement from the state for the appropriate premium assistance amount, which is $43 or sometimes a little bit higher if income is lower. It does not reduce the premium that the parent has to pay to the carrier, as does the federal premium assistance. Also, it can take 2 to 3 months before the reimbursement kicks in. The parent would be reimbursed for prior months and then continue to get a reimbursement check going forward. I want to spend a minute about right share. So right share is it's the same eligibility criteria as right care. It's basically the same program. It's the same Medicaid coverage for parents with minor kids. If the parent is working and has access to coverage through their employer, the OHHS, the Office of Health and Human Services, will look to see whether what the parent would need to pay for coverage for him or herself and her kids would be less expensive than what it would cost the state to have the kids and parent be enrolled in right care or Medicaid, and whether the plan that the employer offers is comparable to the plan or the scope of coverage that the family would have through the right care program. If the employer's plan meets both the cost test and the coverage test, then OHHS will advise the parent to enroll in the employer's coverage, and the state will reimburse the parent for their out-of-pocket costs for enrolling in the employer coverage. The family members will also get a Medicaid card to cover any services that Medicaid provides or Right Care provides, but that are not covered in the employer plan. So that would include things like transportation and interpreter services. We are now going to turn to looking at eligibility of immigrants for health insurance coverage. So all citizens of the country are eligible, and that's somebody who was born in the United States or someone who was naturalized. So lawful permanent residents who become citizens are naturalized. As you look at this chart, you'll see that for Right Care / Medicaid, Children under the age of 19 are pretty much all eligible for coverage as long as they are lawfully present in the United States. If they are undocumented, and that would be somebody who entered without papers or who overstayed a visa, for example, and is now out of status, those children are not eligible for Medicaid. Lawfully present includes people who are not admitted for permanent residence, but who are authorized to live here. And some of the sort of immigration categories of Rhode Island residents include people from Haiti or Somalia or the Sudan or Syria who have an immigration category called temporary protected status, and Liberians, which is a fairly large community in Rhode Island, who have what's called deferred enforced departure status. So kids broadly are eligible for Medicaid as long as they are lawfully present. Pregnant women is really the broadest category. All pregnant women who meet the income limits for Medicaid are eligible, including women who are undocumented. And then for the single parents and single adults and parents or caretakers, a little bit more restricted eligibility for Medicaid. Lawful permanent residents, people who have a green card, kids are eligible right away, but the parents have to have been in status for at least 5 years, have entered the U.S. before August 22nd, 1996, or are veterans, active duty military, as well as their spouses and unmarried children. The people who are refugees, granted asylum, victims of trafficking, certain victims of violence by a partner, the adults are going to be eligible as well. But the other broad lawfully present categories, so the adults from Syria who have TPS status are not eligible for Medicaid while their kids are. The good news is that all lawfully present immigrants can purchase coverage through HealthSource RI. So both if the income for anybody is above the Medicaid limits, they can buy a plan through HealthSource RI, qualify for the tax credits if their income is low enough. And if they're not eligible for Medicaid because of immigration status, they can also buy coverage through HealthSource RI and qualify for tax credits and cost-sharing reductions as long as they have a lawful status. And as you see on the chart on the bottom right, undocumented individuals cannot buy coverage through HealthSource RI, nor can they be eligible for Medicaid. Some tips or extra information about immigrants. While undocumented immigrants and parents with green cards who are here less than 5 years cannot access full Medicaid coverage, if they have an accident or a disability and have to go to the hospital, they can qualify for emergency Medicaid coverage for their hospital bills. Generally, the hospitals will submit an application for those individuals. I wanted to point out something that's important to keep note of. I said that adult lawful permanent residents, people with a green card, are not eligible for Medicaid for 5 years. However, persons who entered as refugees or granted asylum are eligible for Medicaid. Both asylees and refugees may adjust to lawful permanent resident status after 1 year, and they will be issued a green card. However, they maintain their eligibility for Medicaid without the 5-year bar. And the way to know that is to look at the person's green card, and you see the circle here. It's circled around category, and if you see a category that has an AS or a number, that's asylee, or RE and a number, that's a refugee. So somebody who holds that green card with that category, either of those two categories, is eligible for Medicaid without a 5-year bar rate. I should also point out, going back to the Sorry. Now I've gone the wrong one. Sorry, one sec. Just going back to the chart, as I said, children are broadly eligible for Medicaid as long as they're lawfully present. And the children who have DACA status, which were the kids who were brought here and as youngsters and were granted the right to stay in the United States, unfortunately, they are not eligible for Medicaid, even though they're lawfully present. However, they would be eligible for emergency Medicaid, just as all other categories of individuals who are not eligible for Medicaid because of immigration status are eligible for emergency Medicaid. Okay, so let's just jump back. It's also important to know that parents who are not eligible for Medicaid because of their status can apply for their eligible children. So an undocumented parent who has children who were born in the United States are going to be eligible for Medicaid coverage. Also, I just want to point out some other questions that usually come up for immigrants is that receipt of Medicaid or tax credits through HealthSource RI does not affect the right of a lawful permanent resident to become a citizen, and it also doesn't affect the right of an immigrant who does not yet have lawful permanent resident status to adjust to that status. The only exception there would be if Medicaid is used for long-term care services. But getting a health insurance card or premium tax credits will not affect the right to adjust to lawful permanent resident status. Most folks, I'm sure, are familiar with this, but the health insurance plans that are available through HealthSource RI, if the individual is Medicaid eligible or Right Care, they can choose Neighborhood Health Plan or United Health Care. If they're eligible for plan with tax credits, then they can purchase also a plan through Neighborhood Health Plan or through Blue Cross Blue Shield. So we're just going to do two examples to try to bring some of this together. Here's Roger, who's 28 years old and earns $20,000 a year. The Medicaid income limit for a single adult is $16,643, so Roger is not Medicaid eligible, but he is eligible for a tax credit based on his age and income of $1,680 for the year, which translates into $140 a month. So he can buy a silver level plan for $67 a month, which includes the 100 credit, and he also will qualify for help paying for out-of-pocket costs. Here's Marta. She works as a nursing assistant and earns $35,000 a year and has 2 kids. The children are eligible for Right Care because her income is below the kids' Right Care limit. We're back. She is not eligible for Right Care herself because her income is above the parent limit, but she is eligible for a tax credit because family income is below 400% of poverty. She gets a tax credit of $71 a month, so she'll be able to buy a plan for herself for $136. And she's also eligible for the state premium assistance of $43. So her net cost for coverage for herself and her kids are free. Marta will pay $93 a month overall for her health insurance coverage for herself. And she also is eligible for cost sharing reductions. So remember that she'll have to pay the $136 directly to the health plan. The federal government will pay the $71, and then she'll be reimbursed by the state for $43, which reduces her total out-of-pocket monthly costs to the $93. I mentioned when you saw the chart that we started with showing the different Medicaid and QA premium tax credit eligibility limits, that youth who aged out of foster care are eligible for Medicaid until they turn 26. The young adult who aged out, the young person would apply through DCYF for coverage. They only need to prove that they live in Rhode Island when they get covered. They do not have to show income, and over the time that they are, till they turn 26, they don't have to show their income because they're eligible just as a categorical eligibility. This is to provide some parity with children whose parents are able to keep them on their health insurance coverage until they turn 26. The state basically was acting as the parent for the kids, and so those young people are eligible to stay on coverage till 26. It should say here from age 18, not just from 21, because kids age out of foster care at age 18. Sorry for that error. This was a slide that was developed before the state reduced the foster care eligibility, the post-foster care the foster care eligibility to 18. Okay, we're going to turn to how to enroll. Hold on one sec. How to enroll. People can enroll through HealthSource RI. Great news is that people can enroll over the phone. They can call HealthSource RI. They can provide their information. There's an electronic, they can sign their application over the phone, and it can all be done by speaking with a person at the HealthSource RI Contact Center. They can also go to the HealthSource RI Contact Center, which is at Wampanoag Trail in East Providence, or they can go online and use the customer portal and do it on their own, or more likely, go to see a navigator or a sister in the community who will help them walk through the screens, make sure the information is correct, provide valuable information about the application process and all of its details. To find a navigator, people can call 211 at United Way, or go to HealthSource RI, and there's a link to find the navigators in the person's community. They can also submit a paper application, which now is a long DHS application, and we would not recommend doing that at this point in time. There may be a shorter application, again, just for health insurance coverage that is being developed. For now, the best advice for application is to go through HealthSource RI or go visit a navigator. So when can people enroll? People can enroll in Right Care or Medicaid at any time. And they generally have their eligibility renewed once a year. For the qualified health plan through HealthSource, people can only enroll in a qualified health plan during an open enrollment period, which this year will start in November. It will end in December or maybe later. HealthSource RI is still working on when the end date of open enrollment will happen, and that will be for coverage starting in January of 2018. If a person misses the open enrollment or maybe moves to the open enrollment period is over, they can qualify for purchasing coverage through HealthSource RI under a special enrollment period. Special enrollment periods are available if there's a life-changing event, such as a marriage, newborn, or adopting a child, if the person just moved to Rhode Island, if they just became a U.S. citizen, or if they lost other health insurance coverage, like they lost a job, they're now unemployed, they go to apply for coverage through HealthSource RI, if there's a divorce, or if the person has aged off their parents' insurance at age 26, or the young people who get coverage as post-foster care, or if they're cut off of Medicaid. And because the income limits for Medicaid for the parents are fairly low, and for adults, people do flip between Medicaid and buying a qualified health plan with tax credits if they have a little income. I wanted to mention that, well, I said that people apply. Medicaid, you can apply anytime. For HealthSource RI, you can apply during open enrollment. And there's renewal once a year. There are also events that happen during the year that may trigger a change in the person's eligibility. OHHS and HealthSource RI run on a monthly basis a comparison of who's getting coverage with vital records to see whether somebody has passed away and so obviously is no longer eligible, or perhaps they have become incarcerated, in which case they're also not eligible. And then on a quarterly basis, OHHS does an income match between the income that's in the person's account and the state's income database. So this only is going to apply to people who are working in Rhode Island and whose income is recorded through the state's database. If the match between what's in the person's account and income and what the database shows, the income database shows, is different, and it appears that based on the database income is above the Medicaid limit for that person, OHHS will send the individual what's called an ADR, a document saying, we think that we have a discrepancy in your income. Please tell us your current income. If the person does not respond, or if the updated income is actually above the Medicaid limit, then they will get a notice that they are being terminated from the Medicaid program. At that point, if the person thinks that the decision is erroneous, maybe they didn't respond and actually their income is still below the Medicaid limit, they can file appeal. Or if they are no longer eligible for Medicaid, all of those people who are told they're ineligible for Medicaid based on income are going to be eligible to buy a health plan through HealthSource RI and qualify for a significant tax credit because they're just slipping probably slightly above the Medicaid limit. While these post-eligibility verification runs on a quarterly basis, because there were problems with the startup of the integrated eligibility system, OHHS postponed doing these income matches. And that was a good thing because, as we all know, the system was not working that well. But now OHHS is trying to catch up. So on a monthly basis, about 4,000 or 3,000 people are getting notices to say, we've done this income match and we think you may not be eligible. Please provide your current income so we can see if you are. At EPI, we've been sending out information about that so that you, as individuals who help clients maintain health insurance coverage, can watch for those notices and can let your clients know what's going on and hopefully help them submit current information to show that they're still eligible, and if they're not, to help them navigate, get connected with applying for a plan through HealthSource RI. Our goal here is to keep people insured, and all of the individuals who are getting notices that their income is too high for Medicaid are going to be eligible to buy a plan through HealthSource RI. Okay, let's talk a little bit about consumer rights, and we're going to be winding up Medicaid in 3 slides and take your questions. For Medicaid, the decision on application has to be made within 30 days of submitting the application. The customer has the right to a written decision in advance of termination or of any Medicaid coverage. They also have the right to appeal a denial of Medicaid coverage or the termination. They have to file that appeal within 35 days of the date on the notice they receive. If they file the appeal, if it's a termination within 15 days on the date of the notice, their coverage can continue until the hearing decision is reached. The decision should be made within 90 days of the request of the hearing, and the individual has the right to be represented at the hearing. And we'll talk about resources for that in a sec. For qualified health plan and advanced premium tax credit, the person has the right to appeal a decision on eligibility or the amount of the APTC. They have to request the hearing within 35 days of the date on the notice. They can continue to get the tax credit amount that they were receiving if they appeal within 15 days of the date on the notice. They have the right to be represented at a hearing, and a decision from the hearing needs to be reached within 90 days. There's also an informal resolution process for HealthSource RI. You have the phone number here. It's encouraged that people try to use this process to make sure that their concerns, see whether their concerns can be addressed informally as opposed to going through the more formal hearing route. That can lead to a much faster result. And then for consumer assistance in the community, we have two great programs. We have the RI-REACH program, which will help consumers with any sort of health insurance coverage or claim problems. So that's for Medicaid, qualified health plans, and all health insurance issues. Rhode Island Legal Services focuses on low-income individuals, and so they provide help for people who are having problems with Medicaid programs and Medicaid issues. So that wraps up our presentation on healthcare. We're now going to take a few minutes just to see what questions folks have submitted via chat and answer those questions. So please stay on the line, and we'll be right back with you.
Hi, this is Rachel again. I know that many people, due to our technical difficulties, joined late, so I just wanted to note that we are recording this webinar and that we will have several separate times for questions. This is the first set of questions, which are focused on the health insurance questions. Then after this section, we will have information about the Child Care Assistance Program and a section for questions then, and then a section on the SNAP program, a time for questions then, and then followed by a section on DHS paper application process and some questions then. So the first question we have is, if a foster child is adopted, are they still eligible for right care at 18? So hold on a second, and we will get to that question. Just as a reminder, if you have a question, please type it into your chat function, and we will come back online and answer those in a second.
So the answer to that question is, right, that young person would not be eligible for Medicaid based on post-foster care eligibility. However, there are children who are adopted who qualify for an adoption subsidy because they have special needs and may be eligible for Medicaid based on having those special needs. Otherwise, that child is just like a biological child and is eligible to stay on their parents' insurance until they turn 26. Or if they're out of the parent's home and not a tax dependent, they may be eligible for Medicaid as a single adult. So simple answer is, once you're adopted, good news. You've lost your, you have a permanent family, and you're just like a biological child. You don't qualify for right care at 18 based on that status. The next question is, what is the process for a family who moves from another state who still may be covered under a plan from that state? So if it's Medicaid coverage, the state will need to confirm that Medicaid has closed in the other state. If they have been enrolled in a qualified health plan in another state, they apply in Rhode Island, and that qualifies as one of the special enrollment period. They will be closed out, they will want to close their coverage in the state that they've left as they enroll in the new coverage in Rhode Island. The next question was also about adopted children in foster care, so I think we've answered that. And those were the only 3 questions that we've had. If people think of other questions as we go through about Medicaid, we can certainly come back or qualified health plans, we can certainly come back and do a sweep at the end if we have time. Okay, so we're going to pivot from healthcare to the Child Care Assistance Program, but we're going to be seeing Martha again. So hold on for 1 sec. Okay. The Child Care Assistance Program, commonly referred to as CCAP. CCAP is available for parents who are working or also for parents who are attending a short-term training program, which I think many people may not be familiar with. Whether they're working, the parent is working or attending a training program, they have to be doing those activities for at least 20 hours a week. If there are 2 parents in the home, both have to be working or in a short-term training at least 20 hours a week and at the same time. So unfortunately, if mom's working the day shift and dad's working the night shift, they are not going to qualify for child care assistance. The family has to have less than $10,000 in liquid assets, which is not what's in your liquor cabinet, but is money in the bank, money under the bed, etc. We know that most families who are eligible for child care assistance based on their income do not have anywhere near $10,000 in liquid assets, and we're hoping that that requirement can be eliminated in the coming years. And then, of course, income less than the limit. The other basic eligibility, the child must be a citizen or qualified immigrant, right? So it's not the parent's status, but the child's status. So either the child is a citizen or qualified immigrant. And here, it's not all lawfully present kids. It's kids who may be granted asylum or who are refugees or who are lawful permanent residents. There is no 5-year bar for child care assistance. And then the last factor for child care assistance is the parent does have to cooperate with the child support program to establish an order against non-custodial parents. And the trick here is that it's for all children in the household, not just those who are getting child care assistance. So if mom has a 15-year-old from one dad and a 8-year-old from another, mom is going to have to pursue child support against both dads, even though the 15-year-old is not going to be getting child care assistance. And as I mentioned earlier with Medicaid, if the parent can show that they fear harm to themselves or their children, either physical or psychological, from the non-custodial parent, they can ask for an exception from the child support cooperation requirement. So income limits. There are 2 income limits for the Child Care Assistance Program. In order to qualify, the entry income limit is 180% of the poverty level, which you see here. The monthly income limit, for example, for a family of 3 is $3,063 a month. And unlike all the other programs, the income limits for CCAP are the gross pay. There are no deductions applied. There's no modified adjusted gross income from the tax return. It's dollar for dollar counted in terms of determining eligibility. The good news is that parents who qualify, who come in under that entry limit, can stay on as income rises until they meet the exit, what's commonly called the exit income. So family of 3 here, mom gets a job, mom's working, her income is $2,500. She's qualifies for child care assistance. She has a copay, which we'll talk about in a minute, and she can stay on the program as her income goes up, either because she's getting a better paying job, more hours, whatever. She can stay on until her income reaches $3,829 a month. The parent does have a copay if the income is equal to or less than $100 of the federal poverty level. They don't have to pay anything. If the income is above 100%, it's a sliding scale based on income. The copayments range from 2% to 14% of gross income, and there's only one copayment amount regardless of the number of children in the family. So that copayment, if the parent has 2 kids and they're with different child care providers, maybe one's with a family provider and one's with a center provider, the parent will pay one copayment to one provider, and that's all they need to contribute. The state will pay those 2 other providers independently. So here is a chart showing a family copay. So, for example, if you look at a family of 3 with income of $35,000, because we're going to come back to Marta, who was applied for Medicaid and is also going to be getting child care assistance, you'll see that the way this chart works is Marta's income is $35,000 for a family of 3, so she's in that 8% copayment amount. She's going to have to pay 8% of her gross income, and let's see how that works out for her. Here she is. Her gross income is less than the CAP entry limit of $36,000. Her income, her copay, as we said, is 8% of income. So you multiply that by the $35,000 and then divide by 12, and her monthly copay is going to be $233 a month for 2 children who need child care assistance. And she can stay on CCAP as long as her income is below $45,948, which is the exit income limit for a family of 3. As her income rises, she may need to pay 10% of income and then 14% of income, but she's still going to have a significant benefit by getting the child care assistance. The application process for CCAP is the long Medicaid, the long DHS-2 paper application. People have to answer questions where the little CCAP icon appears. There is a pilot that is going on now, and Kim may want to talk more about that when it's Kim's time to talk about what's going on at DHS. So if the family's already receiving SNAP or Medicaid, then they may be eligible to just fill out a short application to provide the additional information that's necessary to determine CCAP eligibility and not have to use the full, long application. For CCAP for training, again, remember that a parent who needs child care to be able to go to a short-term training program of 20 hours a week or more. The training provider will fill out a form to provide to DHS explaining about the program. DHS needs to approve the program, and then the parent submits the application for CCAP coverage. If the parent's training leads to a job, which is what we hope happens, then they would just flip into continuing to get child care assistance based on the new income that they're realizing from their job. Consumer rights for child care assistance, again, decision on the application within 30 days. There's a right to advance notice of termination of CCAP eligibility or a co-payment change, and a right to appeal the denial of CCAP, the termination of CCAP, or the amount of copay. The appeal needs to be filed within 35 days of the date on the notice, but the parent's benefits do not continue until a hearing decision is reached, so the change will go into effect. There is help from Rhode Island Legal Services, both just in determining whether a decision is correct or other CCAP problems, or to represent people at a hearing if that's appropriate. People often need help finding a child care provider. This is the link to the Rhode Island Child Care Resource and Referral Center, both by phone and on the internet. So that's CCAP. Luckily, a fairly brief program to explain. Any questions? There are no questions about CCAP, so we're going to move right into the SNAP program, and I'm going to be turning over the computer to Pam Jennings.
Hi, everyone. Thanks for joining. My name is Pam Jennings, and I'm the coordinator of the SNAP Outreach Project, which is based out of the University of Rhode Island Feinstein Center for a Hunger-Free America. So I'm going to give you a lot of information about SNAP, and starting kind of from the big picture about what is SNAP and going through information about eligibility and the application process and how do folks retain benefits once they start receiving them. So SNAP is the Supplemental Nutrition Assistance Program, formerly known as food stamps, still very commonly known as food stamps. It's a program that's administered by the federal government through the U.S. Department of Agriculture. And in about the late 2000s, the name was officially changed by the federal government to SNAP. And also, you should know that locally here in the state, SNAP is administered through the Rhode Island Department of Human Services. Okay. And our project, the SNAP Outreach Project, we provide assistance to folks to apply for SNAP and also, assistance not only to apply, but to stay enrolled and to troubleshoot issues that people might be having with their SNAP cases. So I'm going to talk in depth about how eligibility for SNAP is determined. So the SNAP eligibility factors include household size, the income of the household, and I'll talk also about some things that are excluded from income, as well as the deductions that count for the household. In some cases, resources may be looked at, and then Rhode Island residency and citizenship status are also a factor in determining eligibility. So in terms of household size, for SNAP purposes, as Linda mentioned, different programs look at households differently. So for the purposes of SNAP, a SNAP household are people who buy and prepare food together and live together under the same roof. Okay, so purchasing and preparing food together and living together under the same roof. So what that means is that you may have more than one SNAP household that's living together at the same address. So you could have two families that are cohabitating in the same address, and they could apply separately as separate households if they are purchasing and preparing their food separately. A couple things to know, though, about household size. One thing is that children under 22 that are living at home with their parents would have to apply together with their parents. If they're living at home, regardless of whether they have their own families, they have a spouse and living with their children. If they're under 22 and living with their parents, then they would have to apply together. If they're over 22 and living with their parents, but not purchasing their food together with their parents, then they could apply separately as a separate SNAP household. Another, thing to know about household definition are that spouses who live together would always have to apply together. So married couple, if they're living together, they would have to apply as a SNAP household, even if they could make the argument that they purchase their food separately and have totally different schedules. If they live together, they would apply together. Same thing applies to partners with children, so partners who are not married but have a child together. They would also have to apply together as one SNAP household. So shifting to talk a little bit more about income as a factor of eligibility. So SNAP eligibility is determined based on monthly gross income. So that's before any taxes or deductions are taken out of the income of the household per month. Okay. So this includes everything from earned income from employment, income received from child support or alimony, Social Security benefits, SSI, SSP, disability benefits, unemployment, Rhode Island Works cash assistance, and pensions that are being drawn down on would also all count as the income of the household. Okay. So in determining what a monthly income is for a household, if we know what a household makes on a weekly basis, we would be multiplying that weekly income by 4.333 to determine what the monthly income is of the household. Same thing if we know what a household makes on every 2 weeks, we would multiply that by 2.166 to determine what the monthly income is of the household. So I also want to mention that some income is not counted, and these are the exclusions. There's more than what I listed here, but just to give you some examples, if there's a person that's paying out, or a household that's paying child support out to a member child outside of the household, that income is excluded. It would not be factored into the gross income of the household. Any military combat pay also is not counted towards the income of the household. And also AmeriCorps stipends are an example of federal programs. Income from AmeriCorps would not be counted as income. Same thing with SIR jobs or Goodwill programs or even work study. So federal employment programs would not count as income. Okay, so let's take a look at the income guidelines. Okay, so I want to mention too, it's important to know that these income guidelines change for SNAP on October 1st every year. I know all different programs, every program, the income guidelines change. It's just a matter of when in the year those changes go into effect. And for Medicaid, it's generally April that the changes go into effect. But for SNAP, it's October 1st that the income guidelines change. So you can see here on this table the gross income limits, the net income limits, and the maximum benefit amounts for different household sizes. Obviously, as you go to households larger than 5, then these limits will increase. So for a household of 1, the gross income limit is $1,831, and then the net income limit is $990. Okay, so for determining eligibility, the first step would be to look at what the gross income of the household is, and then to look at what are their expenses and deductions, and that will determine what their net income is. And I'll explain that in a minute too, a little bit more about determining deductions. So those are the 2 steps, looking at gross income and then the net income, and these are the limits. So the gross income is based on 185% of the federal poverty level, and the net income represents 100% of the federal poverty line. So a couple things to know are that households with folks who are over 60 or disabled can actually have an income, gross income that's above the gross income limit here and still potentially qualify for SNAP. They would also have to meet the net income guidelines, but their gross income may be higher and they could still qualify. Another very important feature of SNAP is that for 1- and 2-person households, they can actually be above the net income limits and still qualify for SNAP. Okay, so for 1- and 2-person households, if they're below the gross income guidelines, we would be fairly certain that they would qualify for SNAP, providing that they meet other eligibility criteria. But so again, importantly, for 1- and 2-person households, they don't have a net income limit. If their income is below the gross income guidelines, they would most likely qualify. And then here you see also the maximum benefit amounts for household sizes. So for a one-person household, the maximum benefit amount is $194. And I'll explain a little bit more about why that's important in a second. So I mentioned that there are certain deductions that are taken into account when determining SNAP eligibility. So remember, the first step is looking at the gross income, and then the second step is looking at net income. So how do we go from gross to net income? We look at the deductions, the eligible deductions for the household. Okay, so there's 5 main deductions. The first one is the standard deduction. Okay, so every single household has a standard deduction that's applied and subtracted from their gross income. The amount of the deduction depends on what the household size is. So just for example, a 1 to 3 person household has a standard deduction of $157 that's applied to their, that's subtracted from their gross income. And those amounts go up as we have larger household sizes. So the second deduction is earned income deduction. So 20% of any earned income of the household will be subtracted from the gross income. So this is a way that SNAP actually provides an additional level of support to working households. So 20% of earned income would be deducted. Another important deduction is dependent care costs. Okay, so this is out-of-pocket expenses for child care or care of an adult family member. Okay, so this is everything from before school programs, after school programs, summer programs, day programs, even transportation to get those family members to those programs would count as an out-of-pocket expense for dependent care. Okay, and that the amount of that cost per month would be subtracted and counted as a deduction. Then let's talk a little bit about shelter costs. Okay, so DHS will factor in a portion of the amount of the household's shelter costs. So they'll look at what is their rent, or if they own their own home, what is their mortgage or property taxes and utilities. Okay. Important thing to know here is that the shelter deduction is actually not the entire amount that the household pays for those shelter costs. Okay, it's the portion exceeding half of the adjusted gross income that is deducted. Okay, so for most, well, not most, but for many households, the shelter deduction is capped at $500 if they're non-elderly, non-disabled households. Okay, so for elderly and disabled households, again, elderly for SNAP is over 60. Elderly and disabled households, there is no cap on the shelter deduction. But it is a portion, it's only a portion related to the adjusted gross income that would be deducted. And then the last deduction that will be factored in are medical costs. Okay. Now, medical costs, importantly, are only factored in for elderly and disabled households, but it's out-of-pocket medical costs over $35 a month that are incurred by those households. Okay. So, again, this is any out-of-pocket medical expenses. So it may be the copays for doctor's visits or prescriptions or transportation to get to and from doctor's visits. It could have been a hospital stay, could have been a piece of medical equipment that had to be purchased, anything that's out of pocket. An important thing to remember with the medical costs too is that if there's a household that has Medicare Part B copay that's subtracted from their Social Security, that also counts as an out-of-pocket medical expense. And I think that is maybe a little known thing with medical costs is that if that, Medicare Part B is subtracted right out of the Social Security, people often don't think of it as an out-of-pocket medical expense, but it certainly does count, and it certainly could impact someone's SNAP eligibility or benefit amount. Okay, so for medical costs, if a household pays over $35 a month in medical expenses, they have a $141 deduction that's applied to their SNAP eligibility. And just a real quick note is that those are the only expenses that are counted. So things like car payments, loans, car insurance, internet, cable bills are not going to be factored into the, are not considered a deduction and not factored in. Okay, so some households may be asked to provide information about their resources, but the vast majority of households do not have a resource limit for SNAP. Okay, so what households does this apply to? Households that are elderly or disabled and have income above 200% of the federal poverty level, they do have a resource limit of $3,250. Okay, so remember that I mentioned that elderly or disabled households might have a slightly higher income than the gross income guidelines and still qualify. So if their income is above 200% of the federal poverty level, then they will be asked about their, we'll use that term, liquid resources again. Okay, so countable resources would include money or money in a checking or savings account or stocks and bonds. So those liquid assets that they have more easily accessible. Things that would never be counted as resources would be, the car of the household, so up to a maximum of 2 for the household, or the value of the home in which that person lives. Okay. So other factors of eligibility are residency in Rhode Island. Okay, so people do not actually need to have a permanent address. We know that individuals who are homeless will certainly do qualify for SNAP, but they do have to be a resident of Rhode Island, and there's no time limit, I guess, so to speak. So they wouldn't have to have been a resident for 6 months. As soon as they become a resident of Rhode Island, they would become eligible for SNAP. They would also have to be, let's talk about the folks who are immigrants. So U.S. citizens would qualify, but there's some rules around qualified non-citizens to know. So refugees or asylees would qualify for SNAP. People who are legal permanent residents, LPRs, or green card holders would qualify for SNAP after meeting the 5-year waiting period if they are over 18. Okay, so adults over 18 do have a 5-year waiting period before they would qualify for SNAP. Children under 18 do not have a 5-year waiting period. Adults with disabilities also do not have a 5-year waiting period, or military members similarly do not have that 5-year waiting period. Okay, so another thing to know about immigrant applicants who are legal permanent residents over 18 will be subject to sponsor deeming, which means that they would be asked to provide information about their sponsors, not only providing the information about their sponsors, but providing income information about their sponsors, and a portion of that sponsor's income would be factored into the income of the SNAP household as well. Up until someone has basically 10 years of work history or becomes a citizen, after that time, they would not have to provide information about their sponsor. All right, so that's all the information, the basics about eligibility criteria for SNAP. So I want to talk a little bit also about how do people get enrolled in the program. Okay, so hopefully a lot of you are already familiar with the DHS-2 paper application, which is a multi-program application. It's used for all DHS programs, including SNAP. And so on the application, every question has a little acronym next to it that indicates which question applies to which program. So we know that it's a long application and can be, can take some time for folks to get through. But if they're applying for SNAP, they would only have to answer the questions that have the SNAP acronym, the little SNAP icon next to those questions. Okay? So there's probably about a little more than half of the questions on the application that are not relevant to SNAP. The interview is also a requirement of the application process. So the applicant would choose whether or not they want to have the interview over the phone or in person in one of the DHS offices. That's something that they would indicate on the application of what their preference is. If they ask for a phone interview, then they would receive a cold call. So they would, DHS would attempt to call them for the interview. If at that point they don't reach them, then they would send them a notice letting them know of a specific interview time. But the first attempt would be a cold call, phone call. And then also documentation is an important part of the application process. So DHS has to verify the identity, the residency, the income, and the expenses. Remember those countable expenses that I talked about? So shelter expense, utilities, dependent care costs. They would have to verify those expenses. Okay? So, there's lots of different types of documentation that can be used to verify those expenses. So once someone applies, how are benefits determined? Okay, so the benefit amount is going to be based on the household size, the income, and the deductions of the household. Okay, so the way that the benefit determination calculation works is that the first step is to figure out what's the net income of the household. Okay, so the applicant's monthly net income is then multiplied by 0.3. From there, we get what their SNAP income is. Okay. From there, we look at the maximum benefit allotment. Remember on that chart a couple of slides ago, we have all the maximum benefit allotments. They would look at the maximum benefit allotment for that household size and subtract that from the SNAP income. Okay, and that's how they would determine what the monthly benefit amount is for the household. Okay. So, as an example, if you have a one-person household and they have $500 as their net income, remember, so that net income is the amount of income after all of their deductions are factored in. They look at, so we have a $500 net income multiplied by 0.3 is 150. The maximum benefit amount for a one-person household is 194. So we take 194 minus 150, and we get a $44 monthly benefit amount for that one-person household. Okay, so most households, this is just an example, different households will have a different net income amount depending on their income and expenses. Okay, so the net income is multiplied by 0.3. Then you look at the maximum benefit amount and subtract the SNAP income from that. One thing to know is that for one or two person households, if their benefit amount results in a negative number, so if you look at the calculation above, if the calculation leads to a negative number, then the applicant would be eligible for the $16 a month minimum benefit amount. So $16 is the minimum benefit for eligible one and two person households. So in terms of the processing of applications, okay, federal regulations require that DHS has to notify their eligibility decision within 30 days of filing the application. Okay, so the time clock essentially starts on the day the application is received at DHS. Okay, so that's the start of that 30-day time clock. It's important to know, though, that there are some applicants that may qualify for faster processing, so 7-day expedited processing. So those are households that have an income less than $150 a month or less than $100 in resources, or whose gross income and resources are less than what their monthly rent and utilities are. So in those cases, the federal law also, requires that a decision would have to be made within 7 days for those kind of emergency situations. Many applicants are able to receive same-day issuance or same-day service in DHS offices. So, those would be folks that have their application and their documentation and have their interview all in the same day, and then would, could get their benefits if, they have a decision made right there on that day, could receive an EBT card on that day. So maintaining benefits, is also an important piece of all of this as well. So there's a couple of things to know about maintaining benefits. One thing is that elderly and or disabled households on fixed incomes will have to submit their recertification every 24 months, so every 2 years. Folks that are on elderly or disabled folks on fixed incomes will have to recertify every 2 years. For all other households, they have kind of a two-step process. So the first is a 6-month interim report, and then the next step is a 12-month recertification. So every 6 months, they are kind of re-verifying their information for DHS. So the first step is the 6-month interim report, and second step is the 12-month recertification. At the time of recertification, clients will also have to have an interview again, and will have to resubmit documents to verify, verify their income and expenses again. Another important part, though, of maintaining benefits is change reporting. So clients who have a change in any of their kind of eligibility criteria should be reporting that right away. Not only that, it's extremely important that changes in address and phone number also get reported right away. So that's done through a change report form that would then get submitted to DHS. So if they have a change in their household size, income, or expenses, that should all be reported right away to DHS using a change report form. So related to maintaining benefits and receiving benefits, applicants are entitled to a written decision notice. I call it the BDN, the Benefit Decision Notice. So for anyone who applies, they should be receiving a benefit decision notice to notify them of their, their eligibility decision. DHS is also required to provide advanced written notice to SNAP recipients prior to changing or terminating their benefits. Okay, so if their benefits will be ending, for example, if they didn't submit a recertification form, then they should be receiving advance notice alerting them of that change. Clients can also, this is important, that they can request a hearing to challenge a denial or termination or reduction in benefits. And this is done using an appeal form. So many people receive the appeal form with a closure denial notice. If not, that's certainly something that the SNAP Outreach Project can help them with, is filing an appeal. Hearings, though, have to be requested within 90 days of the date of the denial or termination notice. All right, so let's talk about how SNAP is used. The benefits are distributed through the electronic benefits transfer card, EBT cards. And those cards are loaded with benefits on the first day of the month, regardless of whether or not it falls on a weekend. It's always the first day of the month that the benefits are loaded onto the card. Benefits do carry over from month to month for up to 12 months. So any benefits that are not used in 1 month would carry over to the subsequent months. Benefits can only be used to purchase food, but I think maybe a little known fact is that they can also be used to purchase seeds and plants that would then lead to food. Okay, so one other thing is that in the supermarkets, the hot prepared foods cannot be purchased with SNAP benefits. Okay, so the food that's like under the warmer in the supermarkets can't be used to purchase, SNAP benefits can't be used to purchase that. Benefits can be used at most supermarkets, convenience stores, and increasingly more and more farmers markets around the state. A relatively new program also is the Food on the Move mobile produce truck that has locations all around the state, every day a couple of different locations. They provide a major incentive for people that are purchasing produce. So if you spend $5, you get $5 to spend to get additional fruits and vegetables. And also many farmers markets do provide bonus bucks. They have an incentive program at many of the farmers markets in the state as well. And also many meal sites. There's many meal sites, congregate meal sites around the state where people can use their SNAP benefits as well. People who receive SNAP are eligible for additional benefits, including free school lunch and breakfast programs, as well as reduced electric rates through National Grid, and lower phone and internet rates as well. So in terms of EBT card replacement, replacement cards are issued by request by calling the EBT customer service line. So if someone loses their card or their card is stolen, they would request a new card through the EBT customer service line. It's 1-888-979-9939, and the replacement card would be mailed to the client. If a client is homeless or has suffered an emergency such as a fire, then they can go directly to a DHS office and request a replacement card. Important to know, though, that clients who request more than 4 EBT cards in a, this should say 12-month period, not 12-year period. If they request more than 4 EBT cards in a 12-month period, they would be referred to the DHS fraud unit. So just to wrap up on the SNAP segment, and I've seen a couple of questions coming in, so we'll see what folks are dying to know about in just a second. But the SNAP Outreach Project is available for folks to provide assistance with applications. We have a team of outreach workers that also do screenings and application assistance and problem solving. So if someone experienced a closure or a change in their benefit amounts and they're not sure why, you can refer them to the SNAP Outreach Project. So there's 2 main ways to do that. One is through our SNAP Outreach Hotline. So 1-866-306-0270 is our SNAP Outreach Hotline, which is answered live on Tuesdays. And then we return calls within 24 hours otherwise. We also have, as I mentioned, a team of outreach workers that are out in the community. And so there's a calendar online on our website, which is eatbettertoday.com, where you can find an outreach worker in the community that can help someone with, the SNAP application or with troubleshooting an issue they may be having. Also on our website, you'll find lots of different materials that are there for download as well. And I want to mention the DHS automated information line as well, which is something that we use quite a lot. It's an automated system that's on the same phone number as the DHS call center. So the phone line 1-855-6 697-4347. In addition to having the call center access, it does have an automated line where people can do a lot of different things, including checking the status of a new application that's submitted, or checking on when a recertification is due or when an interim report is due. So that's another useful service for folks to, for assistance providers to get information to help their clients out. So I'm stopping there and excited to see what questions people have.
So this is Rachel, and just as a reminder for folks, if you have a question, please type it into the chat function. We have a number of questions on SNAP, so give us 1 minute to get organized, and then we will come back and start answering them.
Okay, so the first question is related to medical costs. So if an applicant is not elderly or not disabled, do medical expenses need to be reported? So they would not need to be reported because they would not impact the eligibility of that household at all. So you'll see actually on the application, the question is specific to elderly or disabled household members on medical expenses. Okay, so there's a question about maintaining SNAP benefits. If a recipient starts to work overtime hours for some time, so a few weeks or months, should they report this change even though it's temporary? So I would say that income, that change in income should be reported. Fluctuating income should be reported to DHS. Yes. Yeah. There's a question about EBT cards. If there's a limit as to how much money can be carried over from month to month. And there is no limit for how much money can carry over from month to month. So the answer to that is no limit. What about Peapod? Can you purchase things online using something like Peapod? And unfortunately, no, not right now. There is a pilot program, a USDA pilot program, not in Rhode Island right now, but there is a possibility that that's something that in future years may come about. How can you get reduced phone and internet rate while on SNAP? The reduced internet rate, one provider of that is through the Cox Connect to Compete program, and that's a program that provides usually around $10 a month for a reduced internet rate, and that's for households that are receiving SNAP that have school-age children. And then the phone rate would be something that's provided through Verizon or other. We have a flyer that we can post to the EPI website that has a little bit more information about how to contact those providers. Okay, what are considered utilities? Are cell phones or landlines considered utilities? So cell phones would not be considered utilities, but landlines would be considered a utility. Otherwise, it's electric bills, gas bills, heating bills. Those would be considered utilities. And Kim from DHS is saying that if they don't actually have a landline, then they could accept one cell phone bill for that household.
Hold on for 1 sec. We're just gathering some other questions.
Okay, so there was one specific question about a SNAP client issue, which I will follow up with offline afterwards. We have the name of the person that and the contact of that person that asked that question. So we'll follow up afterwards on that one. But there was a question about if income varies from month to month, how would the SNAP income be calculated? So they would look at an average over a several month period. It's called prospective budgeting, and try and determine kind of based on a several month period, look at a snapshot to determine what a 1 month income would be. How can a homeless individual receive their EBT card when they have been referred to the fraud unit? Yeah. So, I mean, an individual who's homeless can get their EBT card directly in a DHS office. If they've been referred to a fraud unit, that's something that we'd have to look into a little bit more and see kind of what the process is for getting a card if that's the case. So we could follow up on that question. What happens to money on the card year after year? So, I mean, the benefits do carry over. If no benefits are used after a 12-month period, then they would be expunged from the card if they're not, if nothing is touched on the card for a 12-month period. Okay.
And then the last question is around income if someone has just started working and how their income would be calculated.
So for the question around income for a new employee, so I mean the easiest way is to submit as many pay stubs as possible. Typically, DHS would want to look at 1 month of pay stubs. So if they're a new employee, they probably don't have those pay stubs yet. So one thing they could do is provide a letter from their employer stating what their monthly income would be.
So we're going to answer one more question, and then we're going to turn it over to some of the broader questions that were asked earlier. So hold on 1 second.
Okay, so last question, what do we do with families who do not hear back within the 30-day timeline? So you can certainly refer those folks to the SNAP Outreach Project or to the DHS call center, which Kim is going to talk a little bit more about. But the SNAP Outreach Project hotline is the 1-866-306-0270.
Thanks, Pam. This is Linda coming back. There were sort of some questions that had to do with using the new DHS online system, and Kim's going to talk all about that in a sec. There were also several questions about
eligibility of immigrants and also parents who are not eligible and applying for their kids. So one question was, can a person who has TPS status, temporary protected status, qualify for SNAP? And the answer to that is no. If you go back to the chart that we presented as part of the Medicaid, the health insurance overview, on the left-hand side, the two categories of qualified immigrants for most public benefit programs, so for SNAP and Rhode Island Works and Medicaid generally, are the lawful permanent residents, people with a green card, and then the second row that says refugee, person granted asylum, or victims of trafficking and certain victims of domestic violence. And there's a couple of other small categories in that group. Those categories, those two bars, are the ones where kids and parents and adults can qualify basically for public benefits, with the caveat that for adults who have a lawful permanent resident status, there is usually a 5-year wait period, while for kids there is no 5-year bar. So that's for both SNAP and for Medicaid health insurance coverage. The other thing to note, I just want to sort of bring full circle on that, is the card that I showed that a person entered as a refugee or granted asylum, and if they adjusted to LPR, to lawful permanent resident status with a green card, those individuals would still be eligible for SNAP because they their original status was refugee or granted asylum. So the 5-year bar would not apply. So again, if you're working with a lawful permanent resident, you want to look at the green card, and if you see that code of RE or AS, then those adults are eligible for both Medicaid and for SNAP benefits without any 5-year waiting period. There was also a question about can an undocumented parent apply for SNAP for a child that's a U.S. citizen without a state ID? And the answer is yes. Again, for all the public benefit programs, if kids are eligible, if they're generally the case is the child is a U.S. citizen, the parent is undocumented, the parents can apply for the benefits for the kids, and the parent doesn't need to provide any information about themselves other than income, because their income will affect their child's eligibility. So that applies, again, for all the public benefit programs, for SNAP, for Medicaid coverage for the kids, for Rhode Island Works benefits, as we'll go over in next week's webinar. Sort of big picture for immigrants, the rule of thumb is undocumented or ineligible parents can apply for their kids, don't have to provide information other than if they have some income. And there was also another question, which was very good, about are there any services that are available for undocumented immigrants? And the answer to that is, in the food area, people would be going to the food bank and the food pantries for assistance, for health insurance coverage. Remember, they can get emergency Medicaid if they wind up in the hospital, but otherwise there is the network of community health centers that see people regardless of immigrant status. There is also the Rhode Island Free Clinic, and there are 2 free clinics. I'm just blanking on the name of the second one. Yeah, Clinica Esperanza and the Rhode Island Free Clinic, both of which provide primary care services to all people regardless of status. There's an income test for those. I'll just mention now, and we'll come back to this later, that we do have on our website at our Guide to Government Assistance a chart that shows immigrant eligibility for all the different programs, high level, that you're welcome to go look at, and as well as other more detailed information about most of the programs and where people can go for assistance if they don't qualify for one of the public benefit programs. Oh, 2 more questions, which Pam is going to answer.
So question about whether a person can receive both WIC and SNAP food assistance. Great question, and the answer is yes, definitely you can receive both WIC and SNAP. And then a question about our bank savings calculated. So remember I talked about the resource test for folks that are elderly or disabled above 200% of the federal poverty guidelines for their gross monthly income. So for those folks, they would savings account, but for the vast majority of applicants, they would not be looking at bank savings accounts, would not be calculated into their income. So it's only for elderly disabled households above 200% of the federal poverty line that bank savings accounts would be factored in.
Okay, hi everyone. Our last segment is going to be on submitting applications and how to access DHS. My name is Kim Brito, and I am an Associate Director at the Department of Human Services. I wanted to start this segment by answering one question that we missed on the child care segment earlier. The question was around, can a 15-year-old parent qualify for CCAP in order to attend high school? The answer is yes. It does depend on the living situation of the child. If the 15-year-old is living with their parents or with a parent, that income would count towards the household calculation. If that child, 15-year-old, is in a new opportunity home or another structure of that sort, their income would be the only income that is counted. Another clarification for the child care is that eligibility for children is 13 and under. There is eligibility that exists for children who are 13 and over who have a disability. Okay, so we're going to go into the presentation and how to access and submit applications for DHS. So this is for medical, child care, SNAP. It includes our other programs as well, which we'll talk about in the next webinar. But for this one, it's all the programs that we've spoke about. You can access them. Our paper application is on our website. You can also come into any of the field offices. You can call the DHS call center to request an application. You can speak to a representative, or you can use the IVR system to request an application. And you also can apply for all of the programs online at the healthyroad.ri.gov website. Two questions had come in the previous segment about that. Can you apply for benefits and report increase in earnings through creating the account at HSRI? It is absolutely true that you can. It's through the healthyroadri.gov website, and you can apply for medical, MAGI, QHP, as well as all human service programs. Once the applicant has an account created, they have a dashboard where they can report their changes, they can complete their research and their interims. Actually, I take the research piece. They can complete their research, but there is an interview for the research. But the question is, can you do it online? And the answer is yes. And there was a second question that had come through on that is, can you complete the SNAP applications? And yes, you can. So moving forward, our DHS offices, in the presentation, all the offices are listed. Our standard hours are 8:30 to 4. We have 2 extended hours in our Providence office and our Woonsocket office for 2 days a week. They're open from 4 to 6:30. The call center itself is also open from 8:30 to 4. We will be looking to extend those hours. That's a goal of ours. But for now, it's unfortunately until 4. So some tips for, I'm moving too fast with that, sorry about that. So some tips on completing the application. If submitting documents after the completed application is sent in by mail or dropping off at the DHS office, it's in everyone's best interest to have their Social Security number and, if possible, case ID on the document. It just helps us with our indexing to ensure that when the documents are scanned, they're indexed into the correct accounts. We have a central mailing office for those who want to use that. It's the RIDHS. It's a P.O. Box 8709, Cranston, Rhode Island, 02920. A lot of the drop-offs, our smaller offices do not do scanning within the offices themselves. They send it to the central mailing address. So either way, it can be dropped off in the office. It can be mailed into central. And we have our DHS call center number listed there again, because any questions about filling out the application, whether it be the paper application or if a customer is trying to do it via creating an account through Healthy Roads, they can call the DHS call center for assistance. Okay, a little bit about the DHS call center. Since we went live with our new Bridges system in September, we have been building up the DHS call center to handle the human service programs in conjunction with our partners, HSRI, who do the medical program. So when a customer first calls the DHS call center, they have the option to access the IVR, through which they can receive information about their EBT balance. They can the status if their application was received, when their recert or their interim appointments are scheduled for. They can request an application. Again, they can confirm their appointment schedule. They have the option to go straight into the IVR or to speak with a representative. If they select the option to speak to a representative, they're first routed to a triage team. And the triage team gathers basic information about the reason for the call. A lot of times they can answer the questions if it's to request an application or lost an EBT card, things like that. They don't have to go into the queue. The queue is where staff are separated out by their skill set. So we have queues for SNAP, we have queues for RIW, for child care, for complex medical. So the triage team routes the call into the correct queue, and then staff picks the next caller out of the queue and work the case until the end. So once in the queue, the DH eligibility technician picks up the call, addresses the customer's issues from end to end. So that means all the things that are listed on this slide, they're able to do. They can process new applications for a customer if they've submitted a paper application or if they've applied online. The important piece here is that the only way they're not able to complete a new application is if we don't have the signature. So at this point in time, our DHS call center is not able to record the calls, so we're not able to take the voice signatures and record them on the phone. That's another thing that's coming down the line, but at this point in time, they would not be able to do it unless the paper application has been received and scanned in or a customer completed the application using the healthyroad.gov web access. They can process recertifications, interims, change reports. They can assist in determining eligibility. For some of the questions that came in about what's my status, they can answer the status of what's happening with the case. They can finish it as well. If all documents are received, verifications are received, they can complete eligibility. They can issue RDocs requesting for additional information. They can notify clients of their benefit status, answer general SNAP questions, and help customers understand notices that they may have received. So that's the segment on the DHS call center, and we're going to take a moment to look at questions that have come in. Okay, so we gathered the questions. Can you access your benefit info, such as award letters, through the Healthy Roads RI website? Yes, you can. So if the customer has logged in, created an account through their dashboard, they are able to access letters that have been sent out to them, same way that it would happen for medical and Magi. You would receive an email alerting the person to log into their dashboard to retrieve those notices. Let's read this one. Hold on. So one point of clarification is that for the award letters, so when I answered the question about can you access your benefits and award letters, you would be able to access your benefit decision notices or any notices that are generated through the eligibility system. Some of the award letters that are required for SNAP for housing and things like that that are not automated at this point still would require a call to the agency so that we can complete that notice and send it out. It is something that will be automated, but it is not at this point. I wanted to make that distinction, that notices that are generated via the eligibility system would be available on the customer's dashboard. Those that the agency has to print and fill out are still required to be sent by the agency. Second question, is it true that folks, when they submit P.O. Box and Cranston paperwork, it gets lost? That is a bring-in person. So we have definitely had some challenges with scanning and indexing and things that sit in a cloud, which unfortunately sometimes when staff speak about it, they speak as if it's lost because they can't see it in the system when the person's in front of them or over the phone. What happens is it's actually out there in a cloud, it's not lost, and it, through finding some technical issues and working through some things, there have been batch runs that were directed in different ways and such. It's not lost, it just sometimes is temporarily not accessible to the person, but we have been able to find them and associate them to the case. That's where back in the beginning, when we say any document submitted or after the application or not uploaded into the account through the healthyroad.ri.gov, it helps when the Social Security number and the account ID is on it because it ensures it's directly linked to the appropriate account. There have been times that it has been associated to a different account. When that happens, we are able to find it and then reassociate it to the correct account. Let's see. When an app is dropped off at the office, they must stamp as received. They can do that, yes. In the offices that have scanning on site, they stamp it and then they give the customer a receipt back. Let's see. Complaints at times for processing, and sometimes the client goes to office and no record of application or received application. When this happens, it unfortunately, that falls into that category where there are times that batches of things that were scanned in may have went into a different, I don't know the word in the technical world, but it went into a holding cloud, so to speak. We have been able to find them and been able to work them. Unfortunately, it does impact our timeliness on things, and not the best answer here, but when that happens, it is always, we ask the person to complete another paper application, or we would assist them to go into the electronic customer-facing portal and complete one that way. I'm gathering a few more, so let's see. This one's going to take me a moment to think about. So for those who have dropped off documentation numerous times at a DHS office, there's a sign on the door stating either they are only seeing those who are applying for SNAP, they are being told to write their concerns on a yellow piece of paper and are promised a call back. However, they do not receive a call back. So multiple times that documents are dropped off at a DHS office. Unfortunately, there are times when the lobby becomes full and they revert to non-lobby work. I'm assuming that that's when that happens. It's the first that I'm hearing of a letter that's put on the door, but the business process, when the lobbies are full and we can anticipate that the folks that are in the lobby would take it to 4 or 5 o'clock through the end of the day, it does revert to drop-off and non-lobby work. If there's a specific case that needs attention, I would ask that you get that information to Linda, to the folks facilitating this webinar, so that we can follow up on that. If we're not calling back, and should be, that's an issue. So we want to be able to reach out to folks that this is happening to. Typically, for the call center, they retrieve the calls coming in. They're not currently doing callbacks, but if there's a sign that's going up about that, I will definitely look into that and be able to report back on that. That should not be happening. The business process, though, for when the lobbies are anticipated to take the work to the end of the day is to revert to drop-off. Hopefully that helps provide a little more information. We're going to just look. I don't think there's any more questions, but we're going to look one more time, so be right back.
So we have one more question. The question is, what information or form do you need for someone to help others with their application via the Internet? So Kim is going to answer that for us.
So if somebody is assisting an applicant and not, what's the word I'm looking for, not a navigator or not an if you're an authorized rep, you would be able to fill out the application. There's questions in there that would ask, are you an authorized rep? There's not a specific form or anything that is needed. You can create the accounts for the customer as long as you're with the person or you have the authority to go in to do that. The application itself mirrors the DHS-2 paper application flow. So it will ask if you're an authorized rep. It'll ask those specific questions. But to actually just open up the computer, log on to the website, and create an account, there isn't an actual form or anything additional that's needed to assist somebody.
Okay, thank you for all those great questions. This is Linda coming back just to close us out. So I mentioned earlier that we have a lot of resources on our website. There's the guide to assistance programs. You can also sign up to be on our guide update. So you've heard mention that the income limits change for SNAP in October, the income limits change for Medicaid programs in April. As we know of changes that are happening that affect eligibility for the different programs, we put out these guide updates to let people know what's happening. So feel free to go to our website. If you go to economicprogressri.org/guide, you can see the guide, and then you can also sign up for the updates. In addition to sort of program by program information, the guide also has a fact sheet for the income eligibility limits for the DHS programs, which will soon be amending to include the qualified health plan tax credits and cost sharing reductions. And there is a chart about immigrant eligibility for all public benefits. We also have a targeted program around health insurance coverage, which we started once the Affordable Care Act was enacted, where we seek to provide information and updates, particularly around the MAGI Medicaid and QHP programs. And we have some little screenshots here of some of the fact sheets that we put out. One is about eligibility of immigrants for health insurance coverage. The other is just generally about eligibility for health insurance coverage through HealthSource RI for both of those. And both of those are available in English and in Spanish. And we do put out updates about what's happening for eligibility around the MAGI and QHP programs. So we'll have information posted, for example, about open enrollment for HealthSource RI and other pertinent information. So please sign up for, you can sign up for our listserv there as well. At worst, you'll get double information. And we hope that many of you will join us again next week when we'll talk about the other Medicaid programs, health coverage for people with disabilities and seniors. We'll have staff from DHS here to talk particularly around access to long-term services and supports. We'll be covering the Rhode Island Work Cash Assistance Program, the GPA Bridge Program, which is for individuals who have a disability and are applying for SSI benefits and can access a small payment a month, every month, and the SSI State Supplement Program, which helps people with disabilities who get SSI benefits get a little bit more little bit more in their check. A place to register here. Hopefully we won't have technical difficulties. Next week we'll be starting at 9 o'clock. And this is information about, also just about EPI. We hope you'll stay connected with us in a variety of ways. You have my phone number here and my email address. If you have follow-up questions to this webinar or otherwise, please feel free to give a call or send a question via my email address. And I just want to close out by thanking Carson Colmore, who was a silent partner in this presentation, but very helpful. Kim Marola-Brito, Pam Jennings, Rachel Flum, our Executive Director for Hosting, and Juan Espinoza, who was our technical consultant, and also to Blue Cross Blue Shield and United Healthcare for helping to fund this webinar series. Thanks, everybody, for participating, and have a great rest of your day.